Talking about sudden death, basically, there are a lot of underlying causes and there are a lot of systems that are involved in a sudden death. It can be the respiratory systems as well as the genitourinary systems, or we can also ensue that the gastrointestinal system is involved in the causes or the underlying pathologies of the sudden death. So in this section, we'll be dealing with the disorders that can lead as the causes of death whenever an unexplained or whenever an unexpected death occurs. The gastrointestinal hemorrhage is usually the underlying cause or the leading symptom that is usually seen in a lot of cases. It can be hematemesis that is defined as blood in the vomitus. That can be one of the causes and one of the symptoms seen whenever we are saying that the gastrointestinal disorders was the cause of death in an unexplained or in an unexpected death. The fatal abdominal catastrophes are quite common. It can be the traumatic conditions, it can be the other chronic underlying disorders that can lead to be the cause of death in a particular individual. Gastrointestinal hemorrhage is basically bleeding at any point along the GIT. Bleeding from the surgical operation rarely causes death in a person. So it can be a surgical negligence on the part of the surgeon whosoever performed the operation on the gastrointestinal tract. But we cannot say that it is the leading cause. It is quite rarely seen. Penetrating carcinoma of the esophagus is one of the causes that can lead to hematemesis, first of all, and after a lot of blood is lost through that tract, the person can go into a shock-like state. So erosion of the aorta is seen in a lot of cases after the carcinoma perforates the esophagus and it enters the aortic valve. The portal hypertension and hepatic fibrosis is also seen in a lot of cases. And over here you can see that the colonic bleeding is usually 95%, that constitutes 95% of the gastrointestinal bleed events. And then we have the small intestinal bleeding that makes only 5% over here. It can be the diverticular diseases, anorectal diseases that usually are the hemorrhoids, the anal fissures, the fistula in ano, and the salivary, rectal, or the ulcers. Rectal ulcers can also constitute such hematemesis. Neoplasias, for example, polyps, ulcerated lesions, these are one of the leading causes. Then we can have inflammatory bowel disease and infectious colitis that is commonly seen. Angiodysplasias are also seen, and we have radiation colitis and proctitis. And then there are the other categories included in these rectal bleeding phenomena. Then we have angiodysplasias when we talk about the small intestinal bleeding. Angiodysplasias is the leading cause. We have Crohn's disease and infectious diseases. Neoplasias encompassing the polyps and the ulcerated lesions. Radiation is one of the causes. Over here, we have Meckel's diverticulum. Aortoenteric fistulas are seen, and mesenteric ischemias are also seen in such a case. Then we move on to the gastrointestinal hemorrhages as well. The mouth ulcerations is one of the causes. This is the whole GIT basically shown, and all of any abnormality in these structures or carcinomas or trauma to these structures can lead to the GI bleedings. It can be from the esophagus to the anal opening. At autopsy, the identification of the varices is very important. If we identify the varices, any bleeding through that varices can be the cause of death. The congested and bluish vessels around the cardia is one of the causes, and the giveaway lesions are also looked for. Liver cirrhosis and splenomegaly is also looked for over here. Then there are a lot of causes of gastrointestinal hemorrhages. The other causes, they include the gastric, the duodenal, peptic ulcers. Then there are acute erosions seen. Carcinoma of the stomach is one of the leading causes of the gastrointestinal hemorrhages. We see the hemorrhagic diastasis. The colonic lesions, for example, the carcinomas and the ulcerative colitis are also seen. And then we have polyps that usually form the malignant lesions. The abdominal catastrophes are basically the mesenteric thrombosis and the infarction phenomena. That is basically the blood supply to this area is blocked or it's compromised, that causes the infarction. The thrombosis can lead to embolus formation, and the plugs of firm antebottom thrombus are found in this case. Then we have another catastrophe, that is atherosclerosis of the aorta and its mesenteric arteries. We have small intestine is looked for, and if it is found dark and necrotic, that basically indicates that it was a strangulated intestine in that particular case. Then we look for the gut. It can be of blue, red, or almost black in that coloration. Loss of the callosal luster signifies that the blood supply to that area was compromised, or it was friable necrotic wall. Then we have hernias, both femoral and inguinal. They can prove to be fatal. Then we have internal strangulations beneath the fibrous bands in the peritoneal cavity that leads to the subsequent necrosis area. The fatal abdominal catastrophes that basically include the hypostasis due to the alternate dependent loops. And we have the real necrosis at that level as well, that usually is continuous, or the serosa is found to be dull or friable in that particular case. And then we have the fulminating peritonitis that can lead to death if it is undiagnosed, and on autopsy obviously we can find this from fulminating peritonitis. Look for the peritoneal fluid, and it has to be sent to the histopathologist for further assays, and he's going to confirm whether there was any infection of that peritoneal cavity or not. And then we'll move on to the perforated peptic ulcers that leads to the chemical peritonitis, and inflammatory changes are also looked for. So obviously, just to justify these catastrophes, samples, the routine blood samples, that includes the CSF, that includes the blood samples, the urine samples, the vomitus, if it is available, it is sent to the histopathologist, and he's going to confirm whether it was an infectious condition like peritonitis, or whether it was a necrotic or a hypostatic condition in a particular case. The other anomalies that are quite commonly seen are the perforation of the colon through the dry verticillum, or it can be the perforation through the inflamed or a merely distended colon, and it can also be eroded by the fecolids. The other anomalies are the tearing of the senile gut that is usually seen, and it leads to the peritonitis and the carcinomatous conditions as well. Then perforation is seen in a lot of cases due to the overdistension, or it can be due to an ulcer kind of a condition, or an inflammatory condition can lead to the perforation of the gut as well. And then we can have the loss of intestinal contents into the peritoneum. That is again going to lead to a peritonitis-like state, and that is going to be diagnosed after the samples are sent to the histopathologist for further assays. So in this section, basically, we dealt with the gastrointestinal disorders that can cause the foundation for death in any unexplained or unexpected deaths. That is the end of this section. Thank you for watching Scardia.com.